Premier Scott Moe announced the province's new plan to tackle issues in healthcare. The Patients First healthcare plan aims to, quote, improve access to care and ensure everyone has the right care, the right time and place. And the Premier joins me now in studio. Good morning, Premier.
Good morning, Adam. It's great to be here.
Thank you for being with us. So how does this plan address some shortages you're having with, let's say, physicians right now?
Well, it is a fairly comprehensive plan. It's got 50 action items in it. All of those action items really you focus in on enhancing two priorities. I think that this government laid out in the throne speech right after the election, and one was to have access to a timely surgery and diagnostic. Two was to have everyone in the province be able to access or be connected to a primary health care provider. And when you look at the 50 action items that we discussed yesterday, and I'm sure we'll discuss for a period of time, they all lead into enhancing one of those two items, which are also connected. And I would just say this: this is an initial step, taking some of what we are doing that's working and enhancing that, some new initiatives in here, but the conversation will continue.
And what wasn't being done before that is going to be done now to make the situation better for patients in this province?
Well, I think when you look across Canada, there's some real challenges in a post-pandemic environment in the healthcare system. We talk about it at our premiers tables each and every time we come together, and there's different initiatives that are being utilized in other provinces, and some new initiatives here. The Urgent Care Centre, for example, that's here in Regina. But I would say this: there is innovation and tools available to support our healthcare workers in delivering that patient's first level of care that weren't available even just a few years ago. You look at Dakota Whitecap with their virtual care program supporting 29 facilities across the province is one example that 5 or 7 years ago that just wasn't as commonplace as it is today. And so we're trying to bring in some of the tools that we have today, support our healthcare workers across the province so that they can have a broader suite of options in delivering the care that they do.
When provinces announce changes or just enhancements, let's say, to healthcare in Canada, sometimes there's concerns about creating a two-tiered system and being in violation of the Canada Health Act. There's been that criticism in Alberta for what they're trying to do right now. Does this plan in any way move towards privatization in the healthcare system?
No. And I talked with the Prime Minister about it actually when we were in India this past week, and I said I don't think there's anything that we're moving towards that's going to have any challenges with the Canada Health Act. And notwithstanding, the Canada Health Act is outdated, and there does need to be some changes there. And I think most provinces, if not all, are in some degree of agreement there. But that we'll work through that. Some of the initiatives in these 50 action items are about, expanding on our health human resource plan, more physicians, more nurse practitioners being trained, the expansion of the virtual care model that we had piloted with Dakota Whitecap First Nation, and really, as I say, utilizing the tools to support our healthcare workers. But the point on the Canada Health Act, it is outdated. There needs to be some work there, not to create a two-tier health system in the nation, but to essentially support how we're delivering healthcare in today's environment, understanding that technology is different, healthcare delivery methods are different, how people access their healthcare is different as well.
The criticism that from the NDP yesterday, this is a rebrand. Also, talking about how the Urgent Care Centre in Regina was aiming for 24 hours. That hasn't been the case. What do you make of those two criticisms?
Yeah, I'm sure there'll be some politics and fair questions on the plan. I hope there are fair questions on the plan with an intent to always make it better. And, I've been in this position. I've been honored to be in this position for a while, and we've had a lot of politics in the last 8 years or so. And what we're trying to do, not just with this plan, but with a lot of the decisions that we're coming to as a government, is we're just trying to do the right thing. And whether it's healthcare, whether it's some of our international engagement, we're just trying to really harken back to how communities in our province and our nation were built, and they were built strong when people came together to build hockey arenas and halls and what have you. And we have a lot of politics going on in the world right now. What we're trying to do is to remove some of that, talk to healthcare workers, talk to patients, talk to all that are involved in this province, and ultimately just do the right thing. There'll be fair questions, and I welcome those.
And you mentioned engagement internationally. You recently returned from a trip to India. You were there with the Prime Minister. What did you learn from that recent trip?
Well, I learned that we have a different prime minister, obviously, and he's very much focused on international engagement and securing some of our trade channels internationally. We appreciate that. That's always been a focus for us. We were able to put together a long-term uranium supply arrangement with India. Cameco was able to bring that together, and that's appreciated. Made some effort, I think, and built some additional relationships in the agricultural file, in particular in the pulses and whatnot. But what I did learn is, and this is an opportunity for all of Canada, both prime ministers had indicated they want to come to the CEPA negotiations, or the Comprehensive Economic Partnership Agreement negotiations. They want to see that come to fruition this year. That's a big statement by Prime Minister Modi and Prime Minister Carney, and that is I think a real positive and an opportunity for not just our province but all Canadians.
The conflict in the Middle East is something that we've been talking about on the show. It's obviously been top of mind for many here and around the world. We're seeing, the cost of things go up. Gas prices is the most noticeable early on, but we're expecting that other things are going to be more expensive. What are you watching for with this latest conflict?
Well, my first hope is that it ends soon. Conflict is not good wherever it is, and we've seen far too much conflict in the world in the last few years, whether it be the Russian invasion of Ukraine, what we see happening now in Iran. And so my first hope is that it ends for, as a global citizen. It breaks my heart to see people that are losing family members, and it's just awful. Second to that, we play a role in supporting other countries that we talk about it all the time. We supply food, fuel, and fertilizer to the world, over 160 countries each and every year. Well, that's pretty relevant right now. And we're a trusted supplier, and we're an ethical supplier, and we're a sustainable supplier. And so, within that, some would say that's an opportunity. It's actually an opportunity for us to come into our own as a province. We don't want to be a provider or supplier or make a sale one year. We will, I suppose. What we want is to have trusted long-term trading relationships beyond just the articles that we are selling or providing, but to have those trusted long-term relationships with countries around the world. And I would hope in these times of conflict, and I know just in this year being in a few countries, that's what the world is looking for. And so Saskatchewan, I think, is well poised to support in this space.
And you mentioned a few weeks ago that the government's anticipating a deficit budget that you'll be announcing next week. I know you don't give away hints of what's coming. We saw a bit of that yesterday with the healthcare plan of what's to come in that space. Knowing that the cost of oil is going to go up and other things are going to be affected by this, and that, depending on what it is, it can affect the budget in one way or the other. What's your message to people ahead of next week's budget?
We had some difficult decisions to make in our budget formulation this year, and all provinces and the federal government, in fairness, as well. We're seeing some deteriorating revenue lines, some erratic revenue lines, which is actually even more challenging. And the decision was: are we going to make some significant cuts in the services that we offer, or are we going to continue on protecting some of those services that we have in Saskatchewan? And you're going to see deficits, in my opinion, across the nation at the provincial level this year. We're probably as resilient or more resilient than any other province. But what you saw yesterday with our Patients First healthcare plan is an all-in commitment to continue to invest and open up the conversation even beyond investment to using today's tools and innovation to support how we're delivering healthcare in this province. And so it's a little bit different than just adding money to the conversation. We're trying to draw out suggestions, advice from everyone in the healthcare sector, as well as patients and families experienced the healthcare sector, as all of us have. So it is, I think what you saw yesterday was really the commitment that this government has to, in this case, protecting our healthcare services and that investment moving forward. So we will see a budget here, a deficit budget here. And what I would look to is essentially across the provinces is keep an eye on the per capita deficits, and that is going to be the comparison that we'll be looking at.
Are you concerned about the long-term implications of running deficits year after year, or is that just the situation you find yourself in if you don't want to raise taxes?
The goal is to balance. The goal is to balance. And the concern of long-term deficits, as a Canadian at the federal level, I think about that a lot. And in my role as Premier, I certainly think about it here in the province of Saskatchewan. There are measurements, and it is relative to the size of and growth of your economy. However, the goal should be to balance. And so we're going to continue to have some pretty tough conversations around, what does our capital budget look like moving forward? For example, in this province, it's been significant the last number of years. Can it be that significant for, let's say, the next 3 to 5 years? So there's still tough conversations to be had, but it is about priorities and balance, and that's where I think we are arriving at this budget, and I'm pretty confident in, for example, the initiative yesterday, and I think you'll see a few others when the budget is released.
And I need to just mention briefly that your school captured the national championship in women's basketball over the weekend, and back to back for the Huskies. You must be pretty excited about that.
Aren't they an exciting team? And I used to watch a little bit as I had a relative's daughter that played with the Cougars here in Regina, and so we used to go watch. It's in particular when they played the Huskies. But our USAS sports, all of it is pretty exciting and some of the best in the nation.
Premier, thank you for your time.
Take care.